Today I'm going to talk about PEP treatment and the AIDS virus. PEP treatment was developed several years ago for the treatment of the AIDS virus and has been noted to be very effective if taken within 48 hours with with some loss of life up to 72 hours after infection by the hive virus that causes AIDS. Looking at that fact, what can we figure? We can figure something comparatively simple. These people have a medicine, if taken within 48 hours of an exposure to the hive virus that causes AIDS, a cure. It's available. You can get it in emergency rooms. It's just a matter of people being told about it. There was a statement put out in 2017, I think it was June 6th, concerning this. So it's been official for a while now. The problem was the exposure part of the thing. How could you figure out whether or not you had AIDS or had been exposed to AIDS? Well, in Swaziland and several other southern African countries, HSV2 and HSV1 consist of a fairly considerable amount of the population. But what we're seeing is that the main hive version in those countries is hive 2. And where hive 2 is predominantly the hive virus that is causing the AIDS epidemic in your area, if hive 2 is the primary virus, then you can figure one thing like you can in Swaziland. And what can you figure in Swaziland? In Swaziland, 27% of the people, adult population, have the AIDS virus, or hive 2 in this case. Of that, about 90%, according to the University of Washington, in their HSV2 HIV study of 2006, hive patients with HSV are about 90%, meaning 90% of your hive patients have HSV. So you take the 27% of the hive patients, times it by 90%, that gives you 24%. They have both hive and HSV. Now, a little bit more math. If you take 24% and you go to the World Health Organization studies on HSV, global studies on HSV, and get the African numbers, in Africa in 2003, 66.7% of the population of Africa had HSV, which is a STD as well. It's a sexually transmitted disease. In 2012, that had dropped to 31%. If you go back and you look at that other figure I just mentioned, that little math I did a minute ago on HIV and HSV, and you figure, well, both HSV and HIV are occurring at a rate of 24% of the adult population. And you say, 24%. Well, let's figure out how many people that have HSV have HIV. How many? Let's kind of reverse the situation there, and let's start with HSV. Okay, that's 24% have both. Divided by the number of HSV percentage. That's 31. Comes up to roughly about 3/4. It's actually 0.77%. Or I should say 77%. So you figure 77% of your HSV patients have hive 2. That's my numbers. And I derived it from studies done by University of Washington, information from a avert.org. That's where I got the 20. Well, you can find the 27% in a number of spots, but that's where I got it from. And from the World Health Organization's HSV studies in both 2003 and 2012. So, how can we use this along with PEP treatment? Okay, let's take PEP treatment as the example. You need to have rapid exposure identification. Okay? In areas where HIV-2 is predominant, there is a high rate of HSVs, people being infected by HIV. It exceeds 50% in most of those countries that have high HIV-2 numbers. Where most of the rest of the world, it's HIV-1, and it's nowhere near as heavily saturated into the population. In other words, there's not a high rate of it in the population of HSV victims. So, though my exposure test is true when it comes to the University of Washington study on HSV and HIV in 2006, which stated that 90% of your HIV patients had HSV. So if somebody has groin sores, which is what HSV is, or mouth sores, then you can pretty much say you need, if you had sex with them, or they have hemorrhoid which hasn't been tested, or needle sticks, in other words, you shared needles, then you need to consider going to get PEP treatment the next morning. If that happens, you need to say, well, hey, I need to go to the hospital. I need to get this PEP treatment. If I can get it within 48 hours, I have almost 100% chance of not contracting AIDS. Think about that. Almost 100% chance you won't contract AIDS from that person, even if they had it. That's why I say 48 hours and not 72 hours. The CDC and WHO say 72 hours. But it's not 100% cure rate. So I don't use that number. I use the 48-hour number. You can wait 72 hours, but you're more likely to end up getting the virus permanently. Now you can say this ain't a cure. That's up to you. The CDC and the World Health Organization actually list it as a preventive medicine. But preventive medicine is supposed to be given before you contract a virus, not afterwards. If you've been exposed to HIV today or tonight, and tomorrow morning you go in and get PEP treatment, then what? Wait a minute here. This is not before. I'm not taking this PEP treatment before. I'm taking it after I got infected. Think about that. That means it's a cure. That's a big difference in the way they like to say it and the way I like to say it. It is available. I don't have any money invested in them or anything like that. My exposure test is simple. Watch for groin sores, hemorrhoids, or sharing of needles. Either one of those, if you do them the night before or during the weekend, if you can get there before that 48 hours is up, then you've got a very good chance of not contracting AIDS, even from somebody who had AIDS. Some of this information is available on what's called WHO.int, or at least it was last year. They keep changing their numbers and updating their figures and everything, updating it for the latest information and stuff, and sometimes they lose some good information. Why with modern day data systems they don't keep 20 years of records available to the public that wants to go in there and look at it, I don't know. But with terabyte hard drives, I don't see why they can't keep what may be a gigabyte's worth of information that would tell you the complete world statistics and world history of AIDS all the way back to the 70s. it wouldn't take a terabyte hard drive. But basically, PEP treatment can be used to cure the AIDS virus if you get to the place and start taking the medications within 48 hours. It takes 4 weeks of medications to clean your system completely. But it will do that, and it is, according to the CDC, it's effective. They have released it, and it's authorized by the FDA, which is a Food and Drug Administration of the United States. They're the ones that authorizes new medicines in the system in the United States. It's authorized already. I didn't have anything to do with that. I'm just trying to give you an idea of what to look for and when you should go get PEP treatment. If you wait until you use one of them tests that tells you whether you got AIDS, it's too late. If you want to call CDC up, call them up. If you want to call your doctor, call your doctor. PEP treatment has to be started according to their information, by 72 hours. But that includes some risk, some add-on risk. If you get there within 48 hours, you have almost zero risk, which is a whole lot better risk factor. I'm sticking with my 48. I mean, if they want to stick with their 72, knowing it could cost 25% of your life, hey, I'd rather be worried about the 48. That way, you're talking about maybe 1 or 2% of you it cost you your life, versus 25, 30, maybe more percent. I think it was 80 to 90% effective at 72 hours and almost 100% effective at 48 hours. If I remember the statistics correct from CDC Info's site. And that's been over a year, almost 2 years ago. So I'm sure they've updated the information. They may have even eliminated the information I was looking at. I've seen them eliminate information before. So because I didn't want to keep it up there. Basically, PEP treatment can be used to cure the AIDS virus. My exposure test is very effective in countries with HIV infections. In Africa, where there used to be a high rate of HSV, which is the information I used to initially call the 10S rule, when I posted it back in the comment section of some AIDS report back in, might have been 2011-12, something like that. Then again in Armed Forces Network in the United States, Army Times website back in 2014, 2015. I mentioned this all the way back then. The first time I put it out there in a South African newspaper internet site under the comments, I said it was 10% effective. Okay. By the time 2015 came around, I had seen information that moved it up to about 50% effective. That's when I included the University of Washington study on an HSV hive from 2006. I didn't have that the first time I put it out. Then in 2017, just before the Olympics, I put out more information. What was that, 2018? Well, that was 2018. Sorry about that. And I've been working on it ever since, because there's a lot of new information that's come out that I didn't know about. So I updated everything, and I came up with a number of different tests and stuff. I got a pre-played 10S check, which is where you check yourself before you go up, make sure you don't have groin sores or hemorrhoids. That will reduce your chances of catching AIDS, even from somebody who's got it. Then there's the 10S rule still, which is when you check your partners before you have sex to make sure they don't have hemorrhoids or groin sores, which reduces your chances. If they do have groin sores and you have sex with them, you can get the groin sores yourself. Even if you don't get hive, you can still get the groin sores. They're highly contagious that way. Then there's the 10 rule. In the 10 rule, that's the exposure test. That's where you look for groin sores, hemorrhoids, or if you've shared needles. Either of those three, you're at high risk of having been exposed to the AIDS virus, and you need to go to a hospital or doctor within 48 hours. It could save your life. Like I say, I'm not making any money on this. My site is not monetized. If you ever notice, I do not have any advertisements on my site. I really don't care if I ever get any. So you guys just hold on out there. Maybe they'll come up with a cure for people longer that have had the disease longer. But if you want to keep from getting the disease, that PEP treatment, if you have any contact with anybody with groin sores, sexual contact with anybody with groin sores, hemorrhoids, or needle sticks, all three of those are bleeding sores. Hemorrhoids can bleed, giving access to the bloodstream. Groin sores can bleed, giving access to the bloodstream. Needle sticks, clearly, if you stick yourself with a needle, it's probably going into the blood. So all three are direct contact with the bloodstream. Well, Thomas Willis out here. Have a good day.